it's David Greene, founder and CEO of R3 Stem Cell, the nation's leader in regenerative cell therapies. One of the things that I wanted to talk about is, are anti-inflammatory drugs safe? 30 billion anti-inflammatory medications are sold every year over the counter in the United States alone. It's an incredible amount. There's also an additional few million that are prescribed every year by providers in this country. And a lot of people don't think twice about them because they've been around for so long, right? Well, there are some potential complications of anti-inflammatories that should be considered, especially if they're being taken for a chronic period of time, more than a few weeks. What are those potential issues? Well, the first thing that should be understood is that GI-related complications lead to over 100,000 hospitalizations every year in the United States alone because of anti-inflammatory medications. People might not realize that they are taking too much or that their stomach is overly sensitive to them. So it can lead to heartburn as well, indigestion, but that can lead to a peptic ulcer and GI bleeding. Unfortunately, out of that 100,000 hospitalizations that occur every year due to GI-related complications, 16,500 of those patients die on average every year. So that's quite a lot just due to GI-related complications of anti-inflammatories. What else can occur? With long-term use, studies have shown there's a threefold increased incidence of acute renal failure due to anti-inflammatories. That's very high. And the studies show that that number gets worse, goes up with higher dosing and longer periods of time. Okay. Now, when it comes to stroke and heart attack, studies show that there's anywhere between a 40% and 140% increased risk of incidence of those happening. Now, that did depend on, there's multiple anti-inflammatories that showed the increase, others did not. But it's something to consider the longer that you're going to be using an anti-inflammatory. Now, some people don't realize what constitutes an anti-inflammatory. It's not just ibuprofen. Naproxen is an anti-inflammatory, diclofenac, Voltaren, aspirin is an anti-inflammatory. Now, Tylenol is not an anti-inflammatory. It has a different mechanism of action. When you look at the non-operative options for arthritis, something that should be considered is a regenerative cell therapy. And what I mean by that is either a PRP or an exosome or a stem cell therapy can be a great option to consider. All of our centers nationwide offer a free consultation. We have over 40 centers of excellence that collectively in our network have done over 13,000 stem cell procedures in the last 8 years. We've never had a significant adverse event. So when you look at those potential complications like with NSAIDs or narcotics, we haven't seen any of those. It's been a very safe procedure at our centers. Call us today at 844-GET-STEM. We'd be happy to get you in for a free consultation. And you can also visit us online at r3stemcell.com. A lot of educational information on the website. You can download our free consumer guide and click on our YouTube channel. There's hundreds of educational videos there as well. Thank you.